too from the beginning. I probably would have put the pillow up like a little higher. It kind of seemed a little low. So let me give you the pillow back. So let's lift up there. There we go. I can place that. Oh, I don't care. I've been recorded enough. That's all right. So, thank you, Brent. Okay, so looking at professional relationship, professional introduction. We're just gonna literally go down line by line. So, what did we think as far as establishing her role?
Yeah, pretty good.
Great, good. She said who she was. She said what school she went to. She told us she was a student of physical therapy, so we're not thinking she's in high school. She's not, medical student, anything like that. So she introduced, or she spoke to her patient and addressed. Was that your last name or first name?
My first name.
First name.
Yeah.
So ideally, last name would be the best. Okay. And again, you guys are gonna know your partner ahead of time. So ideally, last name. But again, I'm not having you do the whole like, what's your date of birth and now I'm washing my hands. Like ideally, you know that. So those are technical things, but little things. Shirt tucked in, name tag, right? There's no name tag. Shirt was a meh. So just that's gonna be nipped, right? We've got that. And again, usually when you're the first person going, you've got all that stuff, right? It's when you're the second person and you've taken off your stuff and you kind of like, it's sitting there, but you forgot, right? So those are kind of the key things. Now, as their partner, you have to be sure to not be like, hey, make sure you get your tab on, right? So, because that throws people off. Did I tell you that story? I think I told you guys about the cheating, kind of the cheating thing? No. So it was many semesters ago, but what ended up happening was the student was going to be the therapist and he forgot to tuck in his shirt. So the patient, his partner, was like, didn't want him to get points off, so he kept being like fiddling with his shirt, right? Like being like awkward about it, and like fiddling with his shirt, right? So then the therapist realizes like, oh my God, like I forgot to tuck in my shirt. Now like that was blatantly obvious, but like it was clear that like it wasn't like intentional on the therapist's part that they were trying to receive information, right? So he is like this strong student, he just like blacks out. It was like a blackout, right? So he fails the test because he was freaking out the whole time that he was gonna get caught for cheating. So he didn't get caught for cheating, but like he failed because he freaked out. Meanwhile, the patient basically does get reported for cheating because they're telling something, and it seems like you're just trying to help your buddy out. Like it's a point, like, or like you forgot to take off my socks and I'm doing a foot massage. Like they're going to realize that at some point. Don't like shake your foot violently. They'll figure it out, right? Again, it's a point. It's not worth it for you. It's not worth it for them. So just roll with it, okay? So act like you're, what we say, deaf, dumb, and blind. Like you're just there doing what they tell you, okay? So it's just not worth it, right? So just being careful with that. But again, I know that it's really hard where you've been studying with your buddy and like you want them to do well and you know that they're gonna do well, but oh, they forgot this one thing, right? Just let it roll, okay? So anyway, so sure, whatever, we'll get that, okay? Proposes the treatment. So ideally for neck, say like neck and back issues, something like that, just to let them know like that's an area that you're gonna address. What about risks and benefits? Not so much. I mean, she said some risks. So she said some redness, it might be a little uncomfortable. Benefits, in the beginning, she kind of said it to break up adhesions. Again, that's kind of like theoretical, really. But ideally like relaxation, increased blood flow, those types of things. So maybe let's go over the risks a little more strongly. So just being definitive, like this could be a little uncomfortable. You may get some redness from that, totally normal, what she said. But ideally, I want to do this to try to increase some blood flow and ideally to help decrease some of your pain, okay? Like be strong about it, right? If you're kind of wishy-washy, your patient is also like, why do I want this, right? Will it? Yeah, exactly. So consent obtained, check, like that's the big one, right? Are you willing to do this? Check. Treatment area. Now, also with with the consent, she asked about the shirt and got consent, but then what about the lying on the table? Did you guys catch that?
She said, I'm gonna need you to lie down
Right.
on the table.
So it was just like, and then I'm gonna need you to go ahead and lie down on the table when you're ready or whatever. So just again, another little quick question. I'm gonna need you to lie on your stomach. Are you okay with that? Okay, and then kind of go into it. Seems super nitpicky, right? And again, we assume because, the patient is doing it, right? But if we never really specifically ask, they may kind of feel like they're just being forced into it. So we never want anybody to feel uncomfortable. That's why, again, like, especially, certainly working with someone of your same gender can be misconstrued, but again, when you're working with someone of the opposite gender, you really have to kind of go above and beyond to not be misconstrued or not be taken wrong. So again, always just overly asking, like, is that okay? I heard the words come out of your mouth, and sometimes we'll even be like, are you okay with this treatment? And they're like, I need to hear you say it out loud, right? So that patient gave verbal consent, right? Not applied or assumed or implied, but verbal yes, okay? So she's okay with lying on her tummy. She didn't have shoes on, but we would ask about the shoes, okay? Okay, non-treatment area draped, check. Patient supported when necessary. That's not like emotional support, although you are giving emotional support, but looks good as far as her setup, okay? And then patient comfort maintained throughout. So again, sometimes when you guys go in, it could be said of like, well, we'll get to it when we were doing the paravertebral, but like she lied a little bit where she was like, are you comfortable? And she's like, yeah, totally not at all, right? So maintain throughout like the whole time. So again, we don't have a head hole, like a thing to fill in the head. Maybe in that case, we might grab a pillow or something like that. So again, it's something where like initially I could set you up and like you're being a great patient and like you're keeping your neck totally in neutral. But then as the massage goes on and you're relaxing more, now you're falling into like a hyperextension. You as a therapist have got to catch that. So you've got to keep kind of checking in or looking and seeing. So that's going to be kind of the idea of maintain throughout, okay? Okay, effleurage. How did we do overall?
Good.
Fair. Yeah. There's some details in there, right? So kind of looking at some little subtleties. Okay, so if we were looking, did she start at the head and neck? Like kind of, there were some fingers there, but I wouldn't say like it was definitive, right? So I want like you are hugging, hug, right? Head hug, right? Head hug, I'm coming down to the towel. I'm gonna tuck you here and pull you down a little bit if that's okay. Coming down to my towel, I'm coming up, I'm equal here, and 1, 2, 3, definitive, right? And then she kind of just didn't go back up and started going out, right? So again, head hug, I'm coming out to the acromion and I'm coming straight down. Now it kind of looked like, it was like almost like she went out and then there was like a back in kind of thing. Like it wasn't definitive. So I want out over the acromion, coming down and draining, okay? So all just very purposeful, very definitive, okay? That's the kind of details that can be between like a pass and a not pass, right? Now again, it's hard, sometimes it's hard because again, you're doing the technique well. Again, some things that I have to kind of weigh out are like, do you suck so bad that you're gonna hurt somebody, right? And again, that's like an obvious like fail, right? But then it kind of gets a little wishy-washy where it was like you didn't know the line, but like you didn't injure them, right? But at the same time, then I have to kind of go back to, did you study the technique that we asked? Are you able to make your hands do what you are theoretically asking them to do? And if no, so again, if you didn't do the line, and yes, you're not hurting them and it looks wonderful, it looks so comfortable and lovely, like I would love to have a massage like that, but that's not what I asked you to do, right? So again, that could be the difference between passing and failing. It's not that like you gave a horrible massage. And sometimes when I have massage therapists in my class, it's hard for me, like it sucks to be like, yeah, I know you're a certified massage therapist, but like you failed my test, right? That's kind of lame, but at the same time, that's not what we asked you to do, right? So it's just following those directions, okay? So that's your F-large. So taking a look at that, again, drain time, right? So are we just in that test? Your heart's gonna be like pounding, you're freaking out a little bit, and it's just like, it's gonna feel like the longest 3 seconds of your life. Just hang out there and go take that time, okay?
You want to shift in your hips over to the shoulder?
Please.
When you hook?
Totally. So you want to be even. You never want to feel like you're reaching, okay? And I think we assume because it's a small space that we don't have to that we wouldn't reach, but a lot of us are reaching. So just being careful with that. How about kneading? It started off a little rough. Yeah. She's shaped up. Yeah. And that's okay, right? That's okay, because that's the kind of stuff where it's like, that's why sometimes I have you do it more than once. Don't leave. Where are you on? I still need you. Yeah, I still need you. So that's the thing where we've got to kind of like, you know, I'm not going to just have you do it once sometimes. If it really looks like you need a minute. Now, again, some people look far into that and they're like, I thought I did a great job, but oh my gosh, I must not have, because they're having me still do some more. It could be I'm just still writing something. I could be writing like wonderful body mechanics because I want to mention that to you, and now you're freaking out that I had you do it twice and everything crumbles. Like, don't look too far into it, okay? But again, kind of thinking, okay, something doesn't, like, again, I knew it was going to happen in the beginning, because obviously I was like, do kneading. And she kind of hung out and like gave an extra little thinking massage there, right? Like, it's not my first rodeo, right? So like, I know what's about to happen, and then you're like kind of debating of like, and I'm like, oh no, but I can't say anything, so I just let it ride. Okay, so ideally being here. Now for me, I'm not as tall as Lizzie. I've got to lower the table. Thing fell apart, but it still works. So now I'm here again. I'm kind of giving that same little head hug right at the mastoid. I'm gonna pull up and I'm gonna push. So I'm basically like going down to about the base, my MCPs, right? And then I'm going and pushing with my fingertips. That's about as far as I'm gonna get in the neck, right? And again, for some people with longer fingers, you might not be able to go that far, and that's okay. So I'm coming and giving a little push. I scoop back, give a little push, pull, give a little push. So it's like a pull and a push. I'm sliding over those tissues, okay? I'm using my body mechanics to be able to kind of stand up. I'm doing like this, like, I always think of like a choo-choo, right? And then when I get down out to the acromion, that's when I'm gonna do my ins and ups, right? And again, like weight shift, pretty big time, okay? Now, for some folks, I was watching, and again, some people have very mobile skin, right? So if I'm doing like this, that's not doing anything, right? I'm moving her fascia, I'm moving her skin, but that's not kneading. Kneading is this, right? Do you see the difference? She's got some good mobile skin. So I've got to do a little bit more, and I've got to counterbalance, right? If I was just this, she's rocking all over the place. So I've got to get that good motion and get that good counterbalance. The counterbalance is not my emphasis, but I'm not doing nothing. Does that make sense? So I'm still getting that good motion. And again, I'm trying to focus over scapula a little bit more. And then I get back to acromion, I kind of stand back up a little bit, and I do, again, my lifting and pushing, right? Same spot for medial line, okay? I'm in the neck, getting that nice good pull. And then when I get to C7, again, I'm on my paraspinals, but I have to make sure that I'm getting enough push and slide over that tissue, right? Instead of just this. You guys get like, I'm not gonna move my body. I did it, in and up, I did it, right? But does it feel good, right? You can tell, is that nice to give? Okay. Anything other, Dr. Knox, for that one?
No, I just had noticed that the lines were a little muddled and we weren't going all the way back up to the occiput, so
Yeah.
losing full extent of the line.
And then making sure, guys, you see there's a lot of points on like checking in with your patient, okay? So in theory, like every line that you do is like a check-in, right? There's usually 4 lines, that thing's 4 points. I want like 4 check-ins, okay? Now again, sometimes I'll stop you, right? I stopped you early, you only did 2 lines. If you checked in twice, I'll give you the benefit of the doubt and give you that point. If things were silent, like a lot of times you guys are like, okay, do me. Oh, was that okay before? Well, it's kind of a moot point now. You can't do anything about it, right? But I would check in because you guys can tell, like every part of your skin, right? Like skin rolling, it might feel fine here, but it does not feel fine here, right? So that's a good thing to be like, I'm gonna check in, like, is this okay? How we doing? Okay, things are going pretty well. How about this? Is that all right? Okay. Okay. How about over here? You doing okay? Like it seems excessive. I was laughing the other day. I was going to physical therapy to my buddy for my neck. I went to Jason. He beat me up. He's like doing all this stuff in my jaw, and then like asking me all these questions. Hey, how's work? I'm like, your finger's literally like underneath my face. Like, we're not. I can't. I can't right now. I like, it's good. It's great. It's great. Right. So again, there's like time and a place, but just more like, is this okay? That kind of a thing. Okay. All right. Looking at our petrissage. So petrissage, from a line perspective, we skipped a couple, right? From a technique perspective, not terrible, right? But again, I think on this side, she did a little bit of ringing. So she was standing up really tall. And so her wrist was in this like hyperflexion. So then if you're here, the only place for me to pull is to me, right? I've got to get over top of her a little bit so that I can get, it's not going to be a perfectly neutral wrist. Like it just isn't going to happen. But again, I can get it pretty neutral and make sure that I'm pulling away from my patient. So again, we're going to start high up right at mastoid. I'm going to get that nice good pull if I can. I'm kind of like laying over top of her, right? Getting that nice good pull and coming back to the mastoid. Then we have to get the back, right? So again, that's where I'm either coming down and just going over paraspinals, or I can come down and chase around the scapula. Trace, I should say.
So if you do one or the other, you're still fine for them to feel fine. You don't have to do all 3.
Right, you just have to be consistent.
Okay.
So whatever you chose to do on one side, when you come to this side, do the same thing. So again, just the fact that she missed the back, she lost 50% of the points right there, right? So boom, 10 out of 20, like you failed. I don't care if this was miraculous and perfect, you missed half the stuff, right? So I can't possibly grade you, right? So watching out for that. So like, it says like line 2 points, right? Technically, for each line, I'm looking at every single one of those, right? So the hard part about this, I mean, the rubric kind of is like a misnomer where you're like, I did everything else great, but I didn't do the line, so I should only get 2 points off. And it's like, well, yeah, but I'm looking at every single one for every single line, okay? So again, if you miss 2 lines, like you lost half the points, okay? What else? This one, so again, she did pretty good with her pull. So you have to change that position. So have that bottom hand be your last grab, right? So whether I'm here and scooping in to then pull this way, and then as I'm getting done, last grab, I'm coming in for my overhand. You don't have to be that dramatic, right? But if it helps. Looking at our accessory techniques, how did that go for her fingertip kneading?
Didn't do the T.
Fast, true. Was it on the occiput? Wasn't even on the occiput, right? So we've got to make sure wherever you want to stand is fine, right? But again, I'm starting kind of coming up. If you need to feel, that's fine too, right? So I feel C2, and then I'm coming in, and now I'm on the occiput, right? So now I'm coming in, I'm going to take up a little bit of slack. I'm doing that superficial circle, and I'm going a little bit deeper and a little deeper. And then I'm moving laterally. Same thing, a superficial circle, a little deeper, a little deeper. More lateral. And now, remember, the head is round, right? If I go straight across, I might hit 2 on the occiput, and then I'm gonna fall off. So again, if you make that mistake and you're like, it's kind of a little bit deeper here, you're not on it. Hook a little bit more so you're back on that occiput, okay? And then you're coming back in. Now, when we get to neck, I want at least 2 spots on the neck. Again, I'm not gonna push as hard, right? So you should be able, with this depth feeling, feel that tissue. So that's gonna be important too. So again, superficial, I'm taking up the slack of the skin. I'm doing my superficial circle, and then I'm getting a little bit deeper and a little bit deeper, but I'm not gonna push as hard as I can, right? It's a little neck. I don't need to like palpate the front of her esophagus. I just need to get to her spine, right? So then I come down, I do another neck one. Then I come down again, I'm taking up a little bit of slack, superficial circle, a little bit deeper, a little bit deeper. I think you guys are ending up like, boop, right? So being careful with that. So then coming down, just being very specific and particular with your circles, all the way down to here. Then you're gonna come, seems tedious, but then you're gonna get your thumb effleurage where you're coming up in that lamina, okay? And just to the base of the neck, okay? If we look at that suboccipital, so again, little subtleties with this. Because we don't have the, I'm gonna get a hold of, I'll have at least one thing per table to like fill in the hole, right? So ideally that should be a non-issue, okay? Making sure that your patient is relaxed. But like she said, you've got to be down a little bit lower so that you can get your forearms resting on that table. Okay, so don't be afraid to kind of move your patient around. Little subtleties, what I would do is kind of just hover, right? So if I have her rolling over, I'm gonna say, okay, let's pull the pillow. So lift up a little bit, I'm gonna pull the pillow, and maybe just lift it to here for now. And then roll over, and I'm just gonna hold this over top of her, okay? So just little subtleties. Okay, so then that way we're maintaining draping, the littlest amount is revealed, okay? Now, as far as her technique for the paravertebral, looked pretty good, right? She got down, it looked like to about T4. It looked like she was using her ring and middle and ring, and coming up along that lamina, just following along, and then ideally kind of a little lift to the head, and then you just kind of relax out of it. Okay, when you come into that suboccipital release, again, I'm gonna feel for C2, and then I'm gonna just curl my fingers. Okay, you can rest your hand there. So I'm coming in, feeling for C2, I'm gonna scoop under, and then just give a little curl of my fingers. Relax here for me, okay? And she's just resting into me. Now again, you can kind of check, see if her neck is like, argh, right? You know, I think I told you I love TikToks. So bad. But you can do platysma eccentric strengthening, which I didn't know. So I started doing it, and my neck is like so sore. So you do like, well, you know, like that. I was doing it in a restaurant last night. I was getting weird looks. But anyway, so you can strengthen that puppy up and help with the waddle. All right. So overall, you know, not horrible. I probably would have Lizzie do that test again, okay? Which is okay, right? Again, don't be devastated if that happens, okay? okay? Because you're gonna learn from this experience, right? Even if it's happening in the exam. Again, I know we all kind of like get in that mode, and majority of you are probably type A personalities, right? You're pretty smart cookies, or you wouldn't be in grad school at this school, right? We're used to passing tests. We're used to doing very, very well, okay? Sometimes if we don't pass a test, that can be kind of devastating, okay? This is gonna be learning, right? We're learning about ourselves, we're learning about our experience. But don't take it as like, I need to drop out of school. Forget it, I'll never be a PT, this is horrible, okay? You might have just like missed it by 2 points, okay? It's not that big of a deal. So, again, we'll come back, you'll do it again, okay? Now, again, sometimes if it's like, oh man, my kneading, like I stood in the wrong spot. She still did the technique pretty well, right? But it was just the wrong lines, and like she wasn't doing it in the right direction because she was standing in the wrong place, right? If it's something like that where it was like, I know what I'm doing, I just kind of blacked out. Cool. Maybe we can do it again right away. We don't have to like take weeks and weeks to do it again. If it's something like that, but again, I'll feel it out to kind of see, was it just like you forgot something, or like, do you legit need to work on it? Okay.
Did you still want us to stay on the left side of the person during the test, or whatever's more comfortable?
Whatever side is best for you. I just don't want you switching back and forth. Okay, does that make sense? So again, once you kind of commit to that side, I want to see that you can pull the whole thing off from that side. Again, in a clinic, I jump around a ton, right? Kind of just depending, like, I've got kind of my dominant eye and my dominant hand, and like my ideal spot is to stand on the right, but certainly there's some techniques where I do better with my other hand, right? So jumping around can be fine, but in this test, in this thing, I need to know that you can pick whatever side you feel most confident, but I would encourage you to practice on both, but just not jump around. Does that make sense for you guys? Yes.
A question about the shirt tucking. So
Yeah.
the person that comes in and they're the therapist first,
Yeah.
they have their shirt tucked and everything.
Yeah.
So when there's that transition where they're the patient,
Yeah.
so I guess my question is, like, the first person that comes in, like, what are they wearing? Like, are they kind of wearing similar to how we're wearing kind of like athletic type clothes, but they're just tucking in their shirt?
Yeah,
they
so
could
you're
easily
wearing
go
your
into
lab,
the-
like in your like school handbook, you have a lab outfit, right? Theoretically, all you guys should be wearing it. It should be a solid color shirt, it should be solid color shorts. That's what I want you to wear for your test, okay? And then that solid color shirt, ideally, is not a half top, you can tuck it in.
And then for the pants, like elastic waistbands. so
Right,
they can-
exactly,
okay.
yeah, so no like khaki pants, like, this is not your fancy dress up day, right? You're not going on an internship today. You need to be able to lower your pants, so no buttons ideally, things like that, okay? Other questions?
Sorry.
Yeah, go for it.
I was just gonna ask, so, with scrub pants, or can we just wear a scrub?
Just wear shorts,
Short?
just wear shorts. Scrubs you gotta untie them, so just wear shorts. It's 20 minutes of your life, just wear shorts, okay? I know it's cold, just wear shorts, okay? So, I can't get it, they locked the computer thing, so I can't get it, but under your, I think it's your unit 14, I have listed, your partners. I put it as 20 minutes for each test. Now, again, based on how fast you guys change linens, that might take a little bit longer. Don't get mad at us if we're like 10 minutes late, okay? Ideally, we might even like kick it into gear and be a little early. I doubt it on a 20-minute timeline, but I want you, again, still arrive 15 minutes early. And then what we're gonna do is, ideally, we should be wrapped up and done so that we can